This is Big Boy. From his time of birth, his parents and doctors have known that something may be off. As an infant, he displayed some traits that could be observed, such as low muscle tone. He was often unable to support his arms and legs, and his muscles felt loose, like a rag doll. Another symptom which Big Boy displayed as an infant was distinct facial feature. He had almond-shaped eyes, a turned-down mouth, and thin upper lips. A third symptom that doctors discovered was Big Boy's poor responsiveness. They performed multiple tests to assess his reflexes, for example, a Babinski reflex test. In this test, the doctors stroked the sole of his foot, while a baby with average reflexes would bend the toe upwards. Big Boy did not. Based on these symptoms, his doctors diagnosed him with failure to thrive. This is a common diagnosis among infants and simply means that the child is underdeveloped. A number of issues may lead to failure to thrive, such as malnourishment in the womb, heart or lung disease, or nervous disorder. But what caused Big Boy to display these symptoms? Doctors monitored his symptoms closely as he grew older in order to find out. From infancy to age 5, Big Boy developed many more symptoms. One major symptom being the development of a strange diet. Big Boy would complain of hunger constantly. He would often ask for specific foods and only eat those foods. Eventually, this led to some weight gain. Big Boy was not getting the right kinds of food. He was often tired. His doctors eventually recommended his parents to a dietitian. The dietitian assessed his BMI as 20. A healthy BMI for a 5-year-old should be from around 15 to 17. The dietitian formed a meal plan to suit Big Boy's lifestyle to hopefully get him back to a healthy weight. Another symptom that Big Boy displayed was cognitive impairment. His parents first noticed that he learned to talk a bit later than usual and had trouble speaking. In school, he sometimes had trouble with his work and would sometimes fall behind. Some behavioral problems would come with these issues. For this, his parents took him to a psychiatrist. His psychiatrist performed a number of cognitive tests and recognized a verbal learning disability, speech development issues, and some obsessive-compulsive tendencies. From this, his psychiatrist formulated a plan for Big Boy in his school. For example, he was given visual aids during verbal lessons. He attended therapy to learn how to cope with changes in his routine, speech therapy for his speech development, and physical therapy in order for him to improve his muscle tone. By managing Big Boy's symptoms, he was able to live life as a happy 5-year-old. But his doctors knew that there must have been an underlying cause of his symptoms. Their initial diagnosis was autism. But was this the real cause of his symptoms? In order to make sure that he was being treated to live life as best as he possibly could, they would dig into these symptoms to find out more.